Silent and invisible. And before it even had a name, SARS-CoV-2 was around in at least 5 U.S. states before we had any inkling of a looming health crisis. According to the National Institutes of Health, blood samples taken from more than 24,000 participants between January and March last year found infections in 7 people in Illinois, Pennsylvania, Massachusetts, Mississippi, and Wisconsin, suggesting infections as early as December 2019.
So this tells us that the virus was circulating well before the first cases were identified at the end of January. And it tells us that it was slowly entering the population.
The discovery provides clues to how the virus moved and mutated.
Travel probably had a lot to do with the way it moved around the country, because where we saw the first cases were actually population centers that tend to be international destinations. Either people in those cities are traveling to other places and coming back, or visitors are coming to those locations. And they're either stopping over on their way to another US city, or they're stopping there and leaving the airport.
The findings from the NIH study support other research that have identified isolated cases of COVID-19 in the US that predate testing for the virus. Research from the NIH and other medical and health agencies such as the U.S. Centers for Disease Control and Prevention and the American Red Cross is important because by examining how the virus behaved in those earlier days, it can inform public health experts on where the virus could go next and how. But these studies don't definitively answer the question of the virus's origins yet.
It's probably a little too early to definitively say it emerged at place X because of Y reason. I think people really want to know that, but as an epidemiologist and a public health professional, at this point, I'm more concerned about how the virus is behaving now.
And crucially, how the emergence of new COVID-19 variants could make the virus more contagious or lethal, or both. Liling, CGTN, New York.